Coming off the pill, side effects. So let's talk about coming off the pill and side effects as a result of doing that. So let's talk about what those side effects are for some women, why it happens, and what you can actually do about it. So perhaps you've tried to come off the pill and you've been faced with many undesirable side effects. You've tried it before and you're scared of what it unleashed last time and you ended up going back on it. Or maybe you would like to come off the pill, but you're scared of what might happen when you do. Perhaps you've heard of things that might result as coming off the pill. You've heard of things that can happen as a result of doing that. So this is one of the big reasons why women often find it really difficult to come off the pill, because they've tried it and then all these side effects come flooding in. So there is a better way. So let's talk about that and what you can actually do about it. So hello, I am so thrilled to be here today. For those of you that don't know me, my name is Michelle Cooke and I'm a period and hormone naturopath. I'm a natural fertility educator and a Practitioner, so a naturopathic emotional release practitioner. And I help women struggling with their menstrual cycles have easy, pain-free periods, emotional well-being, and hormone balance. So I actually am the founder and director of a clinic in Melbourne, which is reproductive wellness, and I see patients both online and face-to-face. So if you have any questions or comments as we go through the live today, as per usual, you can pop them in the comments box down below. If you're enjoying the content, make sure you hit those likes and loves just so that I know that you're enjoying what I'm talking about today and I don't feel like I'm just staring into a blank camera screen and someone's actually watching. So let's get started. So what are the side effects of coming off the pill? So let's talk about them. So the first one could be post-pill amenorrhea. So amenorrhea is just a fancy medical word for lack of periods, okay? Or lack of menstruation. So your periods go missing for several months at a time after stopping the pill. So why does this actually happen? So while you're on the pill, you need to remember that your hormones are actually being suppressed while you're on the pill, and so are your periods as well. You actually don't have a period when you're on the pill. So while you're on the pill, the synthetic hormones tell your pituitary gland in the brain to actually not communicate with the ovaries to make any hormones. So it's blocking that communication. So there are no natural hormones that are being produced during that time because it's being dictated by those synthetic hormones that you're taking, okay? And it takes practice for your brain to actually learn how to communicate with the ovaries again, to send that message through, to get your body to, hey, we've got to produce some estrogen and progesterone now. That takes time because it's been shut down by the pill, okay? So that's why that can happen. The other thing to remember is that while you're on the pill, it actually depletes a lot of your nutrients. So things like vitamin B, selenium, vitamin E, vitamin C, things like that, and zinc. And all of these are very, very important for hormone balance, hormone production, etc. So when you've come off the pill, you're depleted in those. Your body doesn't have enough of those things to actually get the ovaries kick-started and get that hormone production happening. Now, the second thing that could result when you actually come off the pill is hair loss. So it's technically known as telogen effluvium. I always have trouble pronouncing that one. So that's when a large amount of hair follicles on your head enter a resting phase. So they're actually sleeping. So they're kind of dormant. And this leads to the hair loss as a result. So why does it happen? It happens because the pill actually suppresses androgens, male hormones. It does to all your hormones anyway, but it's suppressing male hormones like testosterone. And then once you actually come off the pill, your body recognizes, hey, there isn't enough testosterone here. So remember, testosterone isn't just a male hormone. It's very important for females as well, for libido, for strength, for endurance, for stamina, for muscle tone and strength, for bone health as well. Really, really important, okay? So what happens is there can be a temporary surge in androgens or male hormones like testosterone because your body's like, oh, there's not enough. I've got to make more to catch up for lost time. So that's what happens once coming off the pill. And this usually doesn't take place after coming off every type of contraceptive pill. There's only usually particular ones. So usually it will be the synthetic estrogen types, or it will be the combination pills, okay? So particularly ones that contain anti-androgen progestin, which is like a synthetic form of progesterone, such as Diane, Yaz, or Yasmin. So they quite commonly can result in that. And the overproduction of androgens can continue for months after to make up for that lack of time because, you know, you haven't been producing testosterone. It has to catch up. So you may have noticed that the hair loss typically sort of shows up about 3 to 4 months after stopping the pill. Maybe it doesn't happen straight away, okay? Another thing that can happen, so this is number 3, is post-pill acne, okay? So you've got pimples and cystic acne appearing typically at its worst around about that 3 to 4 months again after stopping the pill. It may come sooner, everyone's a little bit different, but generally you kind of see it at its worst sort of 3 to 6 months after stopping the pill. And you may get this regardless of whether you've had it before you went on the pill or not. Maybe you didn't have it and you could still potentially get it after coming off the pill. And this is due to the same reasons as I mentioned above, because as I mentioned, the pill will suppress androgens, which is your male hormones like testosterone. And basically that results in, if your male hormones are suppressed, it will suppress the amount of sebum on the skin to that of a child. So once you stop the pill, your body's thinking, oh, there isn't enough oil on this skin, because we normally have oil produced by the sebaceous glands on the skin to lubricate the skin and protect it. But your body recognizes once you're off the pill, there's not enough oil here for protection. She's an adult, she's not a child. Why is that happening? So it will overproduce sebum then to make up for that. Okay. So also another thing is the pill will actually stop the pituitary gland in your brain from producing LH, so luteinizing hormone, and FSH, so follicle stimulating hormone, which will tell your ovaries to produce testosterone. So we sort of spoke about that already. And the pill will increase sex hormone binding globulin, which decreases the amount of testosterone in the body because it kind of binds it all up, so it's not available to be used. So that's another reason why you get acne after. It's just catching up for lost time. So initially your ovaries will produce too much androgens, okay? So that will lead to the overproduction of sebum, that will result in oily skin, and that will result in acne. So as you can imagine, after stopping the pill, the natural response is to produce more androgens because there's not enough, okay? Another thing that can happen, point number 4, is post-pill PCOS. So perhaps you didn't have PCOS prior to being on the pill, but now you seem to be showing symptoms and signs of PCOS after stopping the pill. So why does this happen? So it's finally time for the ovaries to shine, okay? It's been under the shackles of being on the oral contraceptive pill, it's been told, no, you can't produce any hormones. Now it finally can. So they can get to work at producing hormones again. But as I mentioned before, it's making up for lost time. It's producing too much hormones. And there's a surge in androgens or male type hormones, as I mentioned. So this is another reason why some women present with symptoms of post-pill kind of PCOS symptoms. And this can lead to the typical sort of PCOS symptoms. So things like irregular periods, excess hair growth, hair loss from your head. And generally this is sort of temporary. It sort of tends to be sort of around that 4 to 6 months mark. In some women it may be a little bit longer. It just sort of depends, but it's meant to be generally a temporary thing. Now, another thing that can happen, number 5, so period issues. So you might get heavy periods and painful periods. So if you had heavy periods or painful periods prior to going on the pill, and maybe this was one of the reasons why you were prescribed it in the first place, the chances are they will return again once you've stopped the pill. Why does this happen? So because you don't get your period on the pill, remember the pill is shutting down hormone production, it's stopping your periods, you're getting a withdrawal bleed. It's not an actual period that you get on the pill, it's just a withdrawal bleed in response to the synthetic hormones that you're taking. So it looks like a period in response to those synthetic hormones, okay? So that's why it happens, because you haven't addressed the reasons in the first place why you have those heavy or painful periods. So of course they're going to come back once you stop the pill, yeah? Now the 6th thing that can happen is low mood or anxiety, okay? So that's another thing. And this is both a side effect of being on the pill, and also it can happen sort of months after stopping the pill as well. And this can remain if deficiencies of nutrients are still there, or if gut issues aren't sort of fixed up, that can actually still continue on for you, or if hormonal imbalances haven't been addressed as well. We need to remember that there's a big connection between the gut and the mind, so the gut-brain axis, and whatever's happening in the gut, if there's any imbalances in the gut bacteria there, that can affect our mind. So it can lead to things like depression, anxiety, low mood, things like that. So why does that happen then? So when you're on the pill, this will actually alter your gut bacteria. So it can lead to an imbalance of gut bacteria there. So it's an imbalance between good and bad bacteria in the small and the large intestine. So another thing that can happen is it can increase the risk of leaky gut or inflammation to the gut lining. So that's what the pill can contribute to. It can also contribute to reduced motility of the small intestine. So normally your small intestine and large intestine are kind of going in a wave-like motion to move that bad bacteria along out of the digestive system. But if that's not happening, it's going to sort of build up there. And that can increase the risk of SIBO, so small intestinal bowel overgrowth. Now, if you have inflammation and you've got gut bacteria dysbiosis, so you've got an imbalance of good and bad bacteria in your small and large intestine, this increases the risk of having mental health issues, so things like anxiety, depression, low mood. So we need to remember how the oral contraceptive pill actually works. It's a contraceptive. We need to remember that. It doesn't regulate our hormones or menstrual cycles. It doesn't, fix our periods and things like that. It's a contraceptive. And it works in the 3 following ways to prevent you from getting pregnant. So it stops you ovulating and releasing an egg. Another way is that it actually shrinks the S cervical crypt. So inside your cervix, inside the cervix, there's actually crypts that produce cervical mucus. Okay, so it will actually shrink those. It's been shown through research that that's the case. What this does is it actually makes the cervical mucus quite thick and sticky, so it's difficult for the sperm to penetrate and swim through. So that's another thing that's preventing pregnancy. And then it also thins the lining of the uterus as well. So just in case ovulation does occur, it's going to be much more difficult for that egg to actually implant in the uterine lining because it's a bit too thin. So we need to remember that the pill is going to suppress FSH and LH, as I mentioned earlier, which is produced by the pituitary gland in your brain, which stops your brain talking to your ovaries. So as a result, your ovaries' production of hormones is suppressed. There's no estrogen, there's no progesterone. And, which is why, as I mentioned, the pill doesn't regulate your hormones, it doesn't help with irregular periods, it isn't the solution for hormonal acne, and it doesn't fix heavy or painful periods. It's a band-aid solution, okay? So what should I do if I want to come off the pill? It's scary, right? Because you're thinking, I don't want all those things to come back. I don't want my heavy and painful periods. I don't want to get acne. I don't want to get hair loss, all those things. So there is a way that you can do it. And, a lot of women will end up running back on the pill because they're ambushed with all those horrid side effects. So I completely understand why they jump back on it again. So my suggestion would be to actually see a naturopath that specializes in periods and hormones like myself, to support you in a holistic way and to help you come off the pill so that you are less likely to experience these side effects, or at least reduce the severity of them for you, and to treat the reason why you're getting these side effects as well. So is there nutrient deficiencies? Is there gut dysbiosis or imbalance in the gut that's contributing to the fact that you're getting them? Is your insulin too high, which can happen usually as a result of being on the pill? That's causing a lot of inflammation, which causes hormonal imbalance. So there's lots of different reasons, and everyone's very individual as to what they could potentially present with, as a side effect. So, and what usually happens is what I would suggest, what I normally do with my patients, is I actually prepare their body before they even come off the pill. So a few months before you actually come off, we're sort of looking at nutrients that can support your body, can support your hormone production. So it's kind of helping sort of even things out before you actually come off the pill. And once you're off the pill, we can actually help you with, is there hormonal imbalances? Is there gut bacteria imbalances? Do we need to work on any issues that you had prior to going on the pill? Did you have acne before? There's so much that we can do to help you there. Did you have painful or heavy periods prior to going on the pill? There's so much that natural medicine can help with. There's so many herbs and nutrients and dietary and lifestyle advice that we can use to support and help you with those things, to actually address the root cause of the problem instead of just kind of using that band-aid solution. So treatment-wise, we would be using things like herbal medicine, nutritional medicine, diet and lifestyle, and NER, so naturopathic emotional release, so addressing any underlying emotions or stress to do with what you're presenting with your symptoms, with your conditions. Perhaps you're struggling emotionally as well, so it can help you with that too. And in terms of assessment, I would be referring you off for some pathology. Maybe you've already had it done. That's great. We can have a look at that. So we'll be looking at nutritional deficiencies. Are there any there? And 10 times out of 10, there usually will be, because the pill depletes so many nutrients, right? So we need to top them back up in order for you to have hormone balance, healthy periods, regular cycles, not having painful periods or heavy periods. We will be assessing your hormones as well and testing on the right day, because too often I see that hormones are not tested on the right day. There are some hormones that need to be tested on day 2 or 3 of your cycle, and some need to be tested 7 days post ovulation. So that's really, really important to be looking at that. Obviously, with your hormones, we can't really look at that until your cycles come back, but there's heaps that we can do in the meantime to sort of support your body with other strategies. And then we'll be looking at things like your thyroid as well. That's very important to look at in terms of hormone balance. If you're getting painful and heavy periods too, your thyroid, if that's out of whack, that can contribute to that too. We'll be looking at your pancreas, so things like insulin and glucose, remembering that if those are high, it causes inflammation and it causes hormone imbalance and leads to a lot of period issues. Another thing we'll be looking at is assessing gut health. So what's happening there? Has the pill affected your good and bad bacteria in your digestive system? That needs to be addressed, because that will contribute to heavy periods, painful periods, irregular periods, all the things. And we need to remember that, you know, there's a specific family of bacteria called the estrobolome. They actually monitor estrogen levels in the gut. So it's very, very important to keep the gut happy, because that's all part of it too. If that's out of whack, our estrogen can also be imbalanced too. And also looking at the vaginal microbiome, if that's relevant. So if you've been suffering with thrush and recurrent UTIs, for example, which is quite common from being on the pill because it disrupts your bacteria at the vagina, we need to do a little vaginal swab and look there and see, is there bad bacteria? Is your good bacteria too low or high, or what's happening there? And is there any sort of fungal infections? Is there STDs and all that kind of thing? So we can look at that in a lot more detail. And, you know, it's important to see a naturopath too, because the way moving forward isn't using that band-aid solution. We need to find out, why are those things happening for you? Why did you have those things prior to the pill? And actually fixing the root cause of that and helping you in so many different ways, instead of just stopping you from ovulating and shutting off hormone production. It's just not the best way moving forward. And, you know, the thing is, if you just ignore it and you go off the pill, of course those symptoms are going to come back with a vengeance, because you haven't addressed the reasons why you actually had that, you know, hormonal imbalance or period issues in the first place. And it won't go away, you know. So if you would like any help or support with this, coming off the pill and you're a bit scared to do it, and you do really want to do it, but you've had all these hairy symptoms come up, or you've heard about them and you haven't actually given a try yet, I would absolutely love to help you, and I'd like to invite you to a free discovery call. So if you're watching on Instagram, you can actually, there's a link in my bio to book. If you're watching on Facebook or on my YouTube channel, I'll pop the link down below for you. I would absolutely love to help you. So on the discovery call, we can discuss what's going on for you, and you can see if we're a good fit together and what would be involved potentially treatment-wise moving forward. Now, are there any questions before I finish up? I'm just going to check Facebook quickly. If you think of any, or if you're a bit shy, you can always send me a PM or DM afterwards, and I'd be more than happy to answer that for you. I'd just like to remind you as well that all my Instagram and Facebook lives are on my blog, on my website. I've popped a link in the bio and Instagram for you to those blogs, so they're all there with the videos and the written explanation underneath. Or you can just head to reproductivewellness.com.au/blog and they'll all be there for you. So I would like to thank you so very much for watching this evening. I really appreciate you, and I look forward to seeing you next week. FYI, I go live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, speaking about periods, hormones, menstrual cycles, women's health, all the things. So I very much look forward to seeing you next week. If you're watching on my YouTube channel, be sure to like and subscribe, and I'll see you next week. Thank you, everyone. Bye.